Hi everyone. A couple of days ago I had the opportunity to do some dry needling for plantar fasciitis, and I was lucky enough to get permission to film it. So I thought I would put it onto my page here so that everybody could see what dry needling was all about, particularly for plantar fasciitis. Here it is. Hi everyone, I'm here with a patient today called Jan, and Jan is a friend of mine, but the worst thing is that she is suffering from plantar fasciitis. Now, if you don't know what plantar fasciitis is, it is a condition where you get immense heel pain. Usually what happens is first thing in the morning you jump out of bed, you land on it and you think you've landed on razor wire or broken glass, and it's not pleasant at all. So Jan has come to see me today and I am going to give her a treatment with dry needling. So I thought I would share it with you and see how it goes for that. Now, what I do first of all is I just palpate the area, and I ask for feedback from Jan. Is it still painful in there, Jan?
A little bit.
A little bit? Okay, so that's way better than it was for last time anyway. All right. So what I'm going to be doing is I'm going to be doing two different types of techniques. One is called a pecking technique, and the other one is going to be standard dry needling, which is going to be going into the arch of the foot, and then we will just leave that there for a time being. So first of all, I palpate the area where it's going to be the most tender, up on the heel, and around about there, isn't it? Mm-hmm. And what I do from there, tap in a needle, and from there we go straight in, and this is going to sound horrible, we go straight in until we hit bone. Just about there. And then there we go, that's got it, hasn't it? And from there we spend 2 minutes doing a pecking technique in there. Okay. And once we've finished, we take that needle out, put it straight into the sharp spin. Just check that there's no bleeding, and that looks all good. How does that feel in there now? Does that feel like it's less tender?
Yeah.
Good. Okay, now we move on to the second one. Now the one we do here is where we're looking for a referral pattern. So I've got to make sure that I'm in the muscle which will refer pain back towards the heel. So we palpate in through there, find the right ledge, pop the needle in, and from there we go straight down into there. How's that? And she's just given me a thumbs up to say it's all great. Okay, so once we've got the needle in there, I just turn that slowly around just to wind the fascia up around from the muscle, and hopefully what will happen, if I'm in the right muscle, which I should be, you should get a referral back towards the heel.
Yeah.
Is that getting back into the heel?
Yeah.
Ah, good, perfect. There are actually two different muscles in the foot where I'm needling. The deeper being the one that is going to refer back into the heel. The one which is actually closer to your skin is, if I get onto that one and get into the right position, it's actually going to refer pain up into the ball of the foot. So that's how you know you're in the right muscle. Okay, now I'm just going to leave that there for a couple of minutes, and we'll see how it goes from there. Okay, so this has now been in there for about 5 minutes, 5 to 7 minutes. Every couple of minutes I've just been giving it an extra turn just to make sure that the fascia is still bound up around the needle, and it's still referring back into the heel, so it's still activating it. But from there we take that out, straight into the sharp spin, just Just make sure no blood coming from there. Perfect. And how's that feel through there now, Jan? Excellent. And that is how you treat plantar fasciitis with dry needling. So if anybody out there, either you know of anybody that is suffering from plantar fasciitis or anything like that, heel pain, plantar pain, by all means give me a shout or pass on the information, and I can certainly help them out. Cheers, thanks for that. Well, there was the treatment. So as you can see, it's pretty straightforward. So, like I just said, if you do know of somebody or if you suffer yourself, by all means give me a call and I can discuss with you how I can get you back to doing what you love as quickly as possible. Thanks again. See you now.